Well, let's now take a look at the numbers now. And the downward trend in India's coronavirus cases continues today as 55,342 new COVID cases have been reported in the last 24 hours, taking the country's COVID tally past 71.75 lakh. But this is the first time since the 18th of August that India has reported around 55,000 cases in a single day. And this is the second day when the total new infections have been under 70,000. Since a September surge of around 90,000 cases a day. So that's very welcome news that our numbers are coming down in this manner. Now let's focus on Kerala. Kerala on Saturday had reported the maximum number of new coronavirus cases in the country, higher than even Maharashtra. It was the first time since March that any state reported more cases than Maharashtra on any day. And remember, Kerala was touted as one of the first big success stories when it came to controlling the spread of coronavirus there. On Saturday, Kerala reported 11,755 new cases, its highest ever, while the count in Maharashtra that day was 11,416. Now, even today, Kerala is seeing the highest percentage increase in cases. You can see in that graph there, 3.26% among the top states. It's showing the highest increase. But what they have also been emphasizing, the government there, is that the death rate in the state is very low at 0.35%, and that's while the national average is 1.53%. Well, to talk about all these numbers with us, we're joined by Rijo M John, health economist, guest faculty at IIM-Kozhikode and also consultant with the WHO. Thank you so much for joining us again on the show. First and foremost, tell us about Kerala's numbers, the situation that we're seeing here, a huge surge in cases, but also the death rate is very low, which is something the government has been emphasizing.
Thank you, Gargi. Thank you for having me. Can you hear me right now?
Yes, go ahead.
Okay. All right. So, well, you're right that on Saturday, Kerala reported one of the highest numbers in India among all the states. But then that was just a one-day figure. I'm the person who actually look at only 7-day averages and not really interpret the daily numbers.
Sure.
So right now, Kerala, when I look at the last 7 days, it is reporting 8,600 new cases on average for the last 7 days, which is close to 12% of India's daily new cases, and that is actually very high for a relatively smaller state like Kerala with a relatively low population. So that indeed is very high, and as you rightly said, the growth rate of daily cases is one of the highest in Kerala, where it's more than 3.2%, whereas every other state is like much below 3%. And India's growth rate right now is at 1.1% or less than that. So clearly, Kerala's cases are still going up, and if it's not even at the state level. In fact, when I look at the district-wise numbers, you can see that every district in Kerala is seeing really new high cases on every day. Daily new highs are being witnessed in every district. Not a single district is exception there. But again, the only comforting factor is the very low mortality, which is only 0.35%. Compared to, let's say, the 1.52% in at the national level, which is indeed, which of course is the bottom line. That is with respect to numbers. When it comes to deaths, actually, although our mortality rate has been low, we've been seeing rising numbers of deaths. In fact, out of the 1,000 odd deaths that was reported so far, 50% of those deaths were reported in the last 23 days, which is quite significant. But of course, as I mentioned earlier, the mortality is low, but still the absolute numbers are worrying, and it is nowhere comparable to the kind of deaths that Kerala was witnessing in the early phase of the pandemic.
Right. If we can also discuss, the all India numbers, and currently, we don't want to jinx it, but if we take a look at the numbers, we have seen that they are coming down. The daily count is coming down. In fact, we're also seeing a plateauing and, dare I say, even, lowering of the curve. So what in your mind is the situation? Are we past that peak now?
Well, at the national level, I would say that we have passed one peak for sure, but I wouldn't call it the peak.
Sure.
Because, when I track 7-day average numbers, it's been almost 3 weeks now in a row that we are witnessing daily decline in the average 7-day new figures when I look at. So clearly we have passed one peak for now, and our daily, our average test positivity rate also at the national level has been seeing a consistent decline over the last 3 weeks or so. We came down from 9% level to 6.2% levels now, which is pretty a comforting factor. But then, as I always emphasize,
is that testing now enough? Because if we talk about per million testing, we're currently 64,114 per million in terms of testing. And of course, if we talk about other countries like Israel, UK and US, their testing numbers per million are very, very high.
Well, I mean, the test per million has never been enough in India. I mean, to be frank,
yes.
that has been the case right from the beginning. But again, within India, India being such a large and diverse country, there's really no much point talking about these numbers at the national level, because there's huge discrepancy in numbers across states. Even in Kerala, for example, its daily test per million is like almost double that of Indian average, but still its testing is insufficient in my opinion, because it's having a test positivity rate close to 14%, which is more than double the national average. So we have states like, say, for example, UP and Bihar having test positivity rate close to 2% or lower, and on the other hand, we have states like Maharashtra, Goa having test positivity rate close to 20% or 30%. So it really doesn't, and there are a lot of other states having test positivity rate more than 10%, and many of them high burden states. So really, it doesn't make much sense to talk about a test positivity rate at the national level average. So even though we see the national level numbers are coming down, and we sort of tend to interpret it as having passed a peak, the fact is that there are a lot of other states and smaller or even populated districts, like cities like Mumbai and Kolkata, Bengaluru, they are all experiencing daily new highs every day these days. So even as the country has seen a peak, there are many other places which are still going up and up every day. So the bottom line is that it's more about local numbers than interpreting these numbers at an average for the nation as a whole.
All right. So each area we have to look at differently, and because of the situation there. Thank you so much, Dr. John, for joining us on the show.